Hello again, and welcome to the Dr Hilary Show. Coming up, the man leading health coverage in the UK for the world's largest video platform. A former NHS doctor, he's since advised hospitals and health tech companies and led digital health for global brands. Now he's shaping how millions access trustworthy health information on YouTube. I'll be joined by Dr Vishaal Virani. First today, a reminder that the best health and wellness advice I can give you is to click our subscribe button on YouTube. Nothing is more important than your health, so do yourself a huge favour. Click subscribe now, and in return, I'll make sure you receive health tips you can trust and rely on every week. Now, misinformation and making sure you're consuming high-quality health content is central to the work of my guest this week. Dr Vishaal Virani is Head of Health, Kids and Learning at YouTube UK and Ireland. Welcome, Vishaal.
Lovely to be here, Hilary.
Thank you for joining my podcast. Now, you've been in charge of digital health information strategies. You've been advising hospitals. You advise the NHS. It's a very exciting time for you there at YouTube. Tell me some of the successes that you've already had and what you're hoping to achieve long term.
So, so you know, should I focus on the YouTube successes,
Please.
Hilary? Yeah. So it's been a really fascinating journey that we've been on with YouTube Health. Kicked off 5 years ago, just before the pandemic. Actually, our founder, late Susan Wojcicki, was very keen to create much more rigor and intentionality around the health content that our viewers were consuming on the platform. And so we wanted to engage the health industry and raise up health expert voices on YouTube. And so we launched our health shelves a few years ago in the UK and many other places around the world. So I would say this has been our sort of biggest success as far as YouTube Health goes. And so if you search for any health topic on YouTube now in almost most languages around the world, at the top of the search results, you see a shelf labelled from health sources, and that contains videos specifically coming from authoritative sources. So we work with various NHS organisations, lots of health charities, and increasingly lots and lots of individual clinicians like you and I who are dispensing their advice and expertise on the platform. And those videos then get a label against them to say from a licensed healthcare professional, from an organisation with a licensed healthcare professional. And that gives our viewers some context around the provenance and the credibility of the content that they're consuming around a health topic that they've searched for. And so that has been a real success story for us. It's built the foundation for a lot of what we've been able to do subsequently on YouTube.
And it's very reassuring that your background was medicine. You qualified as a doctor in medicine, I don't know how long ago.
That was it was over a decade ago that I qualified. But yes, absolutely. It helps to have that grounding for sure.
I'm sure. So yes, absolutely. It keeps you on the straight and narrow. You know what patients need. You know what health outcomes how they can be improved. So you're busy creating content, and part of that content is to supply verified information, which is reliable and trustworthy, but also to create strategies whereby hospitals can manage things better, where data is collected more efficiently, and patient outcomes improve generally across the board.
Yeah, absolutely. So you know, the goal for us and everyone innovating in the digital health space, in the public health space, in the health information space, I would say we operate in all of those spheres as YouTube, is ultimately to optimize patient health, well-being and outcomes and strengthen health systems as much as possible, and so we think we play a small part in that in that goal, which a lot of other people are also sort of looking to achieve as well.
I read a statistic that something like 3 billion health videos have been watched in England and Wales alone in the last year. So people are increasingly going to technology to get the information that they want. presumably in order to go and see the doctor if they need to, or just to find out about their health, what causes their symptoms, what they should do about it.
Yeah, no, so, and actually, latest figures that we've got from 2024, we had over 4.5 billion views of health videos from UK viewers, and so it was 3 billion, got up to 4.5. So the numbers are growing, and there is a massive demand globally for accessing health information, and it's a kaleidoscope of different things. So it absolutely is, I'm worried about X symptom and I would like to know more about it before I go and see the doctor. So we're seeing now that information asymmetry that historically existed between patients and doctors really erode away because of things like YouTube, where people can go and find information, be informed, and then come to their doctor with certain questions in mind already and have a much more informed discussion with them. Other times it will be that they've been to see their doctor, told that they are that they're in the early stages of diabetes, or they're at risk of diabetes, or that their child has just been diagnosed with asthma, and they want to learn more about what that means. How do I use this inhaler I've just been given for my child? What are the lifestyle changes I can make, given that I have got constraints around my diet? I'm a vegetarian, for example. What can I do for my diet to reduce the risk of my diabetes getting worse? And then there are other times where people want to stay well and they want to prevent health conditions, and we're seeing a lot of content being consumed around exercise videos or nutrition advice, and that's another big driver for people to access health information online as well.
And is it increasingly popular because general practice and primary care is under such strain at the moment? People are finding it difficult to get appointments at all, let alone tomorrow or the next week. Is it because the health services are struggling that it's so popular, or is it popular in its own right?
I think it's popular in its own right. I would say that the pandemic has been a real catalyst as far as seeking health information online goes. So we're seeing an upwards trend in terms of viewership on YouTube across the board. So if you take sports as an example, more and more sports organisations are putting their live matches on YouTube, putting more and more of their highlights on YouTube. The BBC, Channel 4, they're putting more and more of their full episodes of content onto YouTube as well. So across the board, we're seeing this trend towards increasing prevalence of YouTube as the go-to media platform for a lot of people. And so health is then caught up in that as well, because the more time people spend on YouTube, they start to also service some of their health needs and questions on YouTube as well. But I would say the pandemic is what really is. It did two things. First of all, it made people much more aware of the need to educate themselves about health topics and prevent health issues from happening to them. Because if you in the early days of the pandemic, the only treatment we had was advice around wearing a mask and keeping your distance. So it was that information that was basically being prescribed as the panacea. We had no vaccine in the early days. We had no treatment for COVID. It was all about prevention. And a lot of that prevention advice was being consumed by people going online. And so that then created a habit that's now become ingrained in people to say, let me go online, let me search on YouTube for a particular health topic. And then the other thing that happened during the pandemic is that the likes of the NHS and others started putting more and more information on the platform as a means of accessing the population, and they've kind of just continued doing that, and they've seen a really positive snowball effect with their channel and the traction that their channel gets, and so I think that's been a real catalyst for this kind of trend that we're seeing now.
And a really vital question is, how reliable is the information that is on YouTube regarding health? I mean, I don't have to tell you as a fellow doctor that back in the day, people would come into our surgeries, clutching an article from a tabloid newspaper saying, you're poisoning me with the drugs you prescribe. I've just read this article written by a journalist and you're poisoning me. Or I demand stereotactic surgery for my Parkinson's disease because this is what the article is saying. And it was sometimes very misleading. How do we make sure that the health videos and the other health information on YouTube is reliable and trustworthy?
Yeah, no, absolutely. And this is a critical part of what we're trying to do at YouTube Health. I'll say a few things about that, actually, in response to your comments. The first thing I'll say is the real value of YouTube is that you can get multiple different perspectives on a health topic. So whereas in a previous world, everyone was very dependent on what they saw on the news headlines that day on TV or what they read in the national newspapers that day. Now, when you search for those same health topics on YouTube, you will see 10, 15, 20 different perspectives from expert voices around that topic. And therefore, you're not beholden to what one particular journalist is saying or one particular doctor even is saying, but you get that opportunity to get a variety of different views. And as you well know, there are a lot of topics in medicine where nuance is very important, and actually understanding the diversity perspective and how it relates and applies to different communities is really, really important. So that's kind of one thing that's really valuable on YouTube. And, how do we bring those expert voices to the fore? So the second thing I'll say is that we spend a lot of time thinking about how we raise up high quality health information. And the health shelves are a really good example of that. So that has allowed us to place near or at the top of search results health information from expert voices and make that clear to viewers. And so we work really hard with a range of different organisations and individuals across the UK and beyond to cultivate their presence on the platform. And so we've got some fantastic individual clinicians, such as Dr Liz O'Riordan, a breast cancer surgeon, also suffered from breast cancer herself, shares a lot of really, really good medical advice about breast cancer. We've got the NHS National Channel, which has just crossed 200,000 subscribers, has got hundreds and hundreds of videos explaining all sorts of different health topics to the general public. And we'll work really closely with them. We work really closely with Mind, with Samaritans, with various other Cancer Research UK, with various other health charities who are creating fantastic content on specific topic areas. And so that's the second strand for us. Like, how do we raise up that high quality health information through our products, the health shelves, but also through our partnerships? And then the third area is how do we then have the mechanism and the infrastructure to remove the misinformation from the platform? And so we have a set of community guidelines which are available on our website, which gives us a very transparent and objective means of removing content that violates those guidelines. And those guidelines, when it comes to health content, are written in line with Global Health Authority guidance and the latest kind of widely held scientific consensus from around the world. And we'll pay close attention to the WHO, to the NHS and various other health authorities' advice on a topic. And we are always bringing out more and more guidelines around health misinformation topics specifically. So we've got COVID misinformation, we've got vaccine misinformation, cancer misinformation guidelines. And so that then helps us to very quickly remove content which violates those guidelines.
Because I think you banned misinformation about COVID vaccination in 2022 because 11% or something of information was in contrast, contrary to what WHO was saying, what US Centers for Control of Disease and Prevention were saying. And I think you've put in place mechanisms whereby that is stopped or banned.
Absolutely. So that's where the community guidelines come to the fore, because it makes it very clear for anyone and everyone what our red lines are. And if you cross those red lines, that content will be removed from the platform.
That's good to know. I mean, one of the reasons I need to ask that is because I myself is subject to a lot of deep fakes now, because people know my name and they listen to my broadcast, my podcast. Fraudsters and charlatans are jumping on the bandwagon, and they can make it look, as for example, in one, it looks like you've got Adele being interviewed by Graham Norton, and she's singing my praises because she's used a fake product, which I've never been involved in, never would be selling a slimming product online. But people are paying, £50 at a time, £75 for a product that doesn't exist or could be dangerous. And it seems that Meta and TikTok are doing nothing to stop this. They're not checking the information in the first place, and they're not even taking it down when it's pointed out to them that it's fraudulent. So are YouTube, changing the landscape on that, if you like?
Yeah. So I think that it's a really dynamic landscape right now. And the examples that you're highlighting are a relatively new challenge that we're facing. You talked about during COVID, there was so much misinformation coming out. So that was at that time a new challenge. And so for us, our North Star is always making sure that there is highly accurate and high quality information that's factually correct available for our viewers. And so we are always putting in a range of different measures, approaches, processes, guidelines in order to cut out that which is factually incorrect. And so the community guidelines is one. We're now responding to a new world in which there is much more kind of AI generated content that is being made available. And so one of the things that we do is you have an obligation as a creator to declare that your video was made using AI. If there is anything in your video that is replicating what could be a real person or a real place or real product, you then have to declare, and there's a label against that video saying that this video was made with the help of AI. So in the sorts of examples you're talking about, at least viewers know, okay, so there's been some AI involved with creating this video. The other thing that we have got in place is content ID, which is a kind of best-in-class approach that we take to identifying exact matches or copies of content which are not owned by the original rights holder. And we then have a mechanism by which we can remove that copied content from the platform as well.
So if you've got, I think you said 4 billion health videos or pieces of information on YouTube.
Views of health information, yes, in the UK, that is, yes.
Who's checking each piece of information that's put out there on YouTube? Yeah,
so there is a kind of a mix of variety of different individuals in our team, and we've got tens of thousands of people that work in our trust and safety team whose sole job is to review videos to identify any misinformation, any nudity, any kind of harassment content or racism content. And so their job is to review those videos, but then also to be continually refining a set of algorithms that they work in conjunction with in order to pick up those videos as quickly as possible. And as you can imagine, even if we had hundreds of thousands of people, we wouldn't be able to sort of just via those individuals pick out every single video that was violating. And so we work on a series of different algorithms that will then help us to identify videos that are violating our policies. And we will then have one of our team from the trust and safety review that video once it's been flagged by the algorithm and say, yes, actually that is a legitimate flag and needs to be removed. And so we're trying to remove those videos as quickly as possible, ideally before they have any views at all. And we have a metric that we call the violative view rate, which is the number of views that a video violating our content policies has attracted before it's removed from the platform. And our objective is always try to push that number down as much as possible.
And you've got something called a verification code, so that you check the people who create the videos, and they have to fulfill certain criteria, don't they?
Yes, in terms of just to clarify, do you mean when you're uploading a video?
Yeah.
Yes, so it has to, you have to verify in particular that that you own any rights to the music that may be on the video, that you own the rights, or you have the permission to use the footage that is in the video, and those are all things that you would have to verify before uploading. And obviously, as I was saying before, with Content ID and various other things, we have then got checks and balances to identify any copying of content that goes on.
And the creators of some of the health videos, they might be doctors, they might be clinicians, they might be pharmacists, they might be physiotherapists. What about people who aren't qualified, people who are influencers with no background medical knowledge, but who think, I'm going to create a video based on my concepts, my thoughts? Is that a risk to the public that they're not properly medically qualified or health trained in any way, but have an opinion about what people should do to stay well or to become fitter?
Yeah, so the kind of the community guidelines that I described and the algorithms that we have in place, and all of our colleagues in the trust and safety teams, all of those processes and infrastructures I described apply to any video on the platform. So whether you are a medical expert or a layperson, if you are creating content, uploading it onto YouTube around a health topic, it will go through all of the same checks and balances. So it's held to exactly the same standard. So that is a way of removing any blatant misinformation from these lay people. And so once we've rooted out that misinformation, then the question is whether the viewer is interested in hearing from medical experts or lay people. And that's where I think that we have a real our platform is really valuable because of that diversity of opinion. So there are absolutely times, and I think the start of your care journey or your health search journey on YouTube is probably going to be, let's hear what the NHS has to say, let's hear what a medical expert has to say. But actually, you might then want to deep dive and be like, okay, but what does a person like me think about this condition? How does a person like me live with this condition? And so that type of content is really important for us on the platform. And we've got a separate set of shelves which is labeled personal stories. So if you search for living with anxiety, living with depression, living with breast cancer, that a shelf will appear which is labeled personal stories. And that contains videos actually coming specifically from lay people who are talking about their journey on the platform. And we think that's really important to shine a light on as well. And obviously we've rooted out any misinformation that videos may contain. But that is another really important part of how we try to help people with their health journey.
Well, it's really good to hear that you're putting these checks in place. If YouTube can do this, it's a difficult question, why can't other platforms do that? And they're not doing it.
Yeah, so, the way we've always approached this is to say, let's set the industry standard. Let's do things in such a way that the rest of the industry can follow us if they want to. So a really good example of that is when we set up the health shelves, we have a set of health information content standards that the Academy of Medical Royal Colleges, along with, who is the sort of the umbrella body that looks after all of our different medical associations, the College of GPs, College of Surgeons, they all come under the Academy of Medical Royal Colleges umbrella. And they worked with NHS England, with the GMC, with various other stakeholders to create this set of health information standards that we had kind of requested them to do. But we framed that as health information standards for any online providers, with the hope or the aspiration that we as YouTube would maybe be the first use case and we would use those. And every single channel that wants to be part of our health shelves now has to self-attest that they are following all of those standards if they want to be included in the health shelves. But the hope continues to be that the other platforms will also look at that, not just platforms, but all of the other medical websites or general websites which have some health information, even podcasts. Anyone could look at those standards and say, okay, I'm going to abide by these standards and I'm going to tell everyone that I've abided by these standards. So we never said these are YouTube standards. We always said these are industry standards. So that's kind of one of the ways in which we've tried to push the industry to follow our lead.
Well, I very much hope they do. It's very necessary. And I'm very conscious of people thinking, well, what some platforms are doing is potentially dangerous, allowing people to sell products that either don't exist or could do harm. So that's very reassuring. Now, we've been talking about how you run it, the health information on YouTube, the technology, how it's done. In terms of bringing it to life, the outcomes, how are we improving patient outcomes? Can you give me some examples of a patient who's gone to the YouTube site and they've looked at something and really benefited from the information they've gleaned from it?
Yeah, absolutely. So I think this is the greatest joy that I take from the work I do, and it's the greatest joy that our health organizations and health creators take as well, when they see those comments and the impact that the content they are creating has on people. And I always say, I'll come to the examples, but I'll just preface this by saying I always say to people that YouTube is brilliant for all sorts of things. You can watch the football highlights from the fantastic match last night, or you can watch amazing cat videos or anything else that you want to. But with health content, it's different because you are having a meaningful impact on that person's life and you're changing their behaviors and their health for the better. So it just means a lot more. And so it really is a big driver for everyone involved in this process. And so, the majority of what we have to go off are the comments on the videos, because we can't close the loop with individuals ourselves. That is, of course, what some of our health creators can do, and they tell us the stories. But to start with some of the comments, give you an example, there's a video that one of our health creators, Dr. James O'Donovan, put up. He's a GP in Northumbria, and he put a video up about the signs and symptoms of bowel cancer. He had a comment on one of his videos saying, "Thank you so much for this video. If it wasn't for this video, I wouldn't have got myself checked out. And I'm writing to you from the Sunderland Hospital, where I've just had an operation for bowel cancer." And so these are obviously these comments are made publicly available, and therefore we feel comfortable telling others about them. So that's one example. There's another example. We've got a women's health creator called Dr. Simi Adedeji, and she's again a GP in East London has got a fantastic channel breaking down taboos around women's health topics. And one of the videos, there was a comment from a young girl who said, "Thank you so much for this information. I never had a mother who would be able to share these stories and this advice with me. And so this channel has become invaluable for me as I've been growing up." So, stories like that which really touch you and
Very
make you
nice
realise.
to hear that. And of course, it's the same in television. That we cover subjects such as heart disease or cancer, prostate issues, and we get letters saying, "Thank goodness we watched the programme. With that information, I went to the doctor, or because of that, I took my husband to the doctor. We wouldn't go with his prostate issues." And thank you. But of course, you're accessible 24/7. A TV programme might be available for half an hour a day or 1 hour a day, but you're there 24/7 if people want to access that information. So your reach, your accessibility is enormous.
Yeah, absolutely. Though I will say that that the two work very well together. And, as an example, the BBC have got the Operation Ouch programme with the Van Tulleken brothers, which is a fantastic sort of programme for children, teaching them about parts of the body and health. And so they've put those episodes on YouTube. And so actually, suddenly what was on traditional media only available as an appointment to view at a certain time is now 24/7 available for anyone and everyone on the platform. And so, we are only as good as the contributors to the content. We're only as good as the partners who create the content for us. And so one of the things I do always say to our health partners and health creators is the work that you do here really matters because this content is evergreen, and the advice that you're sharing here could be seen by someone 5-10 years down the line. And now obviously it's incumbent on our partners to update their videos when any clinical guidelines change, and they're very diligent at doing that type of thing. But assuming that they've done all of that, that's a video. And a really good example is on the UCLH, the University College London Hospital, NHS Hospital channel, which is a really good channel, actually. They've got a video about how to inject insulin, how to use your insulin pen. And that video is now over 10 years old, but it still gets tens of thousands of views every single day because of the value that it's creating for viewers.
Well, it used to be the case that teenagers who were newly diagnosed with type 1 diabetes using insulin had to go on a summer camp to see other children, their peer group, injecting themselves because otherwise it was a big barrier.
Yeah.
So that must be very useful.
Yeah.
And of all the people that YouTube is helping with their health information, who's benefiting most? Is it patients, viewers who are patients, or is it people who are collecting data? Is it clinicians talking to one another, updating themselves on the latest innovations and things? Who's benefiting most?
So I would say that it's both the patients and the clinicians in different ways. So the patients, I guess we go broader, we'd say individuals, because, as we've said, as I was saying earlier, preventative health information is a really big driver for searches on YouTube. And so actually it cuts across the entire population. People are benefiting from, sometimes it's the subconscious consumption of health information because maybe they're watching a video about kind of yoga exercises that they really enjoy and they find very engaging, and they're actually improving their health without necessarily saying, "Oh, I'm doing this to improve my health." They say, "I'm doing it because I really enjoy this person and the way that she's teaching yoga, or that he's teaching yoga." And so, I would say across the board, individuals are benefiting from multiple different reasons of their health. And then clinicians is a really interesting use case because we see quite a few channels on YouTube which have got millions and millions of subscribers, but they are fully focused on clinician-facing education. So they are providing support for exams that you as a clinician might be about to go through, or showing you how to conduct an examination of somebody's chest or an examination of somebody's foot, checking for any numbness related to diabetes or related to a stroke. And so those videos do really well, and we know it's mostly clinicians watching them because of some of the comments that say, this has been really useful for my exams that are upcoming. And so that's actually a really powerful use case that we see on the platform as well. well.
And of course, none of this is a substitute for going to see your doctor if need be, for a physical examination. It's not a substitute for medical advice from a healthcare professional in the surgery, face to face. Nevertheless, it's a form of education, of information. It teaches what I do as a doctor on TV and radio, and it's important. We only have 7 minutes per patient in the surgery, but here it's an unlimited information source. So it must be very exciting for you. I mean, it's such an exciting sphere. I can feel your enthusiasm for what you're doing. Are there any groups of society that are missing out on it? So the older generation who may not be tech savvy, is this passing them by, or is it your hope that as the next generation comes through, they will be tech savvy and they'll be more able to use it?
So I would say that YouTube is being accessed by pretty much the entire UK population across all age groups. So if you look at the data, over 90% of the UK adult population is on YouTube at least monthly. And if I look at some of the videos, and I was doing this just yesterday because my boss who heads up the whole of sort of YouTube UK had a question about intergenerational, multi-generational content consumption on the platform. So I was having a look at the NHS channel, and some of their aerobics and Pilates videos have got higher watch time from a 55 plus age group than anyone else. And the same applies to a lot of other content on the platform as well, whether it be health information or not. So I think older and younger generations across the board are engaging with the content, and every video will be different. There are videos that the NHS channel has on how to sort of put on a condom, or about sexual health advice, which may be more relevant to a younger audience. But equally, we have lots of videos about topics that are going to touch an older audience. There is a group who will get left behind if they don't have access to the internet. And actually, I don't think that's only the elderly. I think that there is some digital poverty in the UK and very much so in other parts of the world as well, where there isn't that access to the data or the internet that's required to consume some of this information. And so that is, a challenge that we all face when we put our information out online, and there are various different innovations going on which are trying to help to address that internet access challenge that we face. But I think the older populations are not necessarily being left behind here. I think those who don't have access to the internet are, but they're probably two separate groups, and so that's one of the really valuable things about our platform. It really does touch people across all age groups, I would say.
We hear about virtual wards now, hospitals sending patients home with access to IT so they can communicate with their hospital specialists and nurses from their home environment. This frees up bed space in hospitals, but it also means that patients are treated in their own home, but they need to report in with their blood pressure readings, how they're sleeping, how they're feeling. So this is another example of how IT is helpful in terms of people's personal care.
Yeah, absolutely. I think that technology has got such a valuable role to play in empowering people to take control of their own health. And so the virtual wards is a really good example, right? And I think it's that combination of health expert plus the individual coming together through the power of technology. And so YouTube is a very similar example to that, in the sense that you've got the health experts sharing their information, and then you've got the individuals who are willing to engage with technology as a means of accessing that information. And actually, the other thing I'll say about virtual wards is one of our aspirations is to get more and more of the video content that exists online into care pathways, so that when an individual is seeing their doctor and they've been told, oh, we think you're in the sort of early stage of diabetes, and you have the 7 minutes that you mentioned to go through what is an enormous amount of information in one of those scenarios, the doctor can then say, well, here's a really good video that will tell you a little bit more about lifestyle modifications that you can think about for diabetes. And here, by the way, is a really good video from an individual from a similar community to yourself and how they've coped with their diagnosis of diabetes. And so you put a few of these videos together and it gives people a much fuller picture. And when we start to integrate that into the care pathways, as we're starting to do with with some of the NHS organisations we're working with, I think that can be a really powerful force for good.
Absolutely. It makes a change from the old days when we used to say, well, here's a sheet of paper about your diabetes, read that and you'll be fine. So a big step forward. So, Vishaal, a personal question. What's the single greatest thing that you've learned from all your work with your various hats on that has improved your well-being, and what do you live by?
So there's a couple of things I will say on this. So the first one is like just getting outside is so important. And you know, I think there's an irony here because I work. I'm talking about YouTube and how we sit and we watch all this content.
Yeah, absolutely.
But what I will say is, you know, the link to YouTube here is that there is a lot of content which is about getting out into the great outdoors. All of these incredible vloggers who are talking about their travels and going and adventuring in all these different places. All of these exercise videos that are out there where people are talking about their running, journaling their running, for example, and that type of thing. So I think there's actually a lot of content which is then encouraging us to go outside. There's this fantastic channel called, I think it's called Adventures with Mac, which is this sort of slightly more elderly gentleman up in the Highlands in Scotland, I think, who has started a channel a couple of years ago just documenting his journeys through the Highlands and his car and just talking about the walks that he's going on, and he takes us on the walks with him. And it's a really kind of quirky, esoteric channel, but it's just fantastic. You watch that channel and you think, I just want to get up there. I want to go out into those mountains and I just want to go walking. So actually getting outdoors is so good for physical and mental health. I think that for me is the big one.
And you do that?
I do. So actually pandemic was a big catalyst for me as well, and it got me going outside. I don't actually ever set foot in a gym anymore. So I go out running. I've got a lovely farm area near my house, and I've got this nice route, 45 minutes. I go every Monday and Friday lunchtime when I work from home. I'm running around there, and hopefully my bosses are not hearing this. But now I got to take a break from the work, and I go and run around, and that does wonders for my mental health.
Well, what we both have in common is the passion for reliable, important information, empowering patients to learn about their conditions and stay well, but also the love of the outdoors and the need for exercise and looking after ourselves as well.
Brilliant. Well, that's great to hear. Yeah, so important. I think it's only less than half the population is getting exercise in general on a regular basis,
it's a worry.
Which is a real shame.
But if YouTube is empowering people and motivating and inspiring people to take more exercise in the great outdoors, fantastic. Another thing you're doing well. Vishaal, thank you so much for
my pleasure.
enlightening me, certainly on technology, because I think a lot of people are still a little bit wary of it, a little bit afraid of it, but it sounds like you're doing wonderful things. So
no, thank you so much. My pleasure. Thank you for having me.
Well, my thanks to Dr Vishaal Virani. Don't forget, you can watch all my interviews on the Dr Hilary Show YouTube page, including my recent conversation with the author, poet and former Children's Poet Laureate, Michael Rosen. Now, is it true you're a meme?
A meme. Yes, I am. So I did a poem that my son videoed, and it goes like this. We sit down to eat and the potato's a bit hot. So I only put a little bit on my fork and I blow till it's cool. Just cool. Into the mouth. Hop. Nice. Now, my son videoed me and I said, what's that for? And he said, well, that's for a YouTube channel I'm going to make of your poems, Dad. So I said, oh, fine. Is anybody going to watch it? He said, yeah, no, a few people will. So a few people were. And then one day he came to me and he said, Dad, you're a meme. And I said, what's that? And he said, look, some kids in America have clipped a bit of that poem of you just going, oh, nice. And because they're in America, they think that you're not really saying nice, because you think Americans say nice. It's nice, man. Whereas I say nice, and they think I'm saying noise. So they've put subtitles on it to make it clear. So it's written N-O-I-C-E, noise. And I said, is anybody watching it? And he said, well, it seems to be up at about 50 million, Dad. I said, what? What, just watching that? Anyway, yes, and even more. And the result is I get stopped in the street. I was on the way here just now. And people hold up cameras to me and they go, say it. And I have to stand in the street. I know what they want. They just immediately, or they just see me from far off and they just come up to me and I have to go, oh, nice, like that. And I have to do it everywhere. Lads get on buses. You know, I'm sitting on a bus and some lads come on, and I see them out the corner of my eye, and behind me I hear noise. And I look round, and then as they get off, they go, say it. And wait for this, we go to Chinatown here in the West End. Go to Chinatown, I caused a riot. I was walking through Chinatown, people are coming towards me, one guy in front, and he says, you're really famous in China. I said, I don't think so. No, and he said, no, look. And he took out his phone, and there's me, and it had nice in capital letters, and then 2 Chinese letters, Mandarin letters after it. And there's me going, oh, nice. And he said, yes, you're really famous in China. I said, I don't think. He said, look. I said, what does that say there? He said, that says, oh, it's what we call you in China. I said, what? It says, nice grandpa. I said, no. He said, yeah, look.
That's
I said,
brilliant.
He said, oh, no, it doesn't say grandpa. It says in Mandarin, it says nice yeah. You're nice yeah in China. And I have Chinese students at Goldsmiths where I teach.
Fantastic.
And when they come, right, and there's this very serious induction day, and you're sitting there saying, the toilets are over there and the lecture theatre's over there. And then suddenly there's this screaming goes on, seriously. And then they just rush towards me in the middle of this induction day going, it's Mr. Yeah, it's Grandpa Nice. It's Grandpa Yeah. And they come running towards me. And then I have to say it in the middle of this rather solemn induction. I have to sit there going, oh, nice. Anyway, I am world famous for saying nice.
Once again, don't forget to subscribe on YouTube. Do it right now. Make sure you watch the next episode and let's talk about what really matters to you and your health. And for more information and show notes on all our programs, just go to drhilaryjones.com.